and gentlemen, let's put our hands together to welcome our host for this evening, Dr. Tan Ke-siang.
My name is Ke-siang, and I'm very honored to be your host for this evening. Thank you. Okay, before we start, okay, do you all know why you're here? Why? Okay, it's we want to focus on a specific organ in our body, right? Why is it? Eyes. Okay, eyes on me, no need. Okay, so now I want you to look at the person next to you, hold his or her hand, look deep into his or her eyes. Okay, hold hand and look deep and tell the person, my name is Ke-siang. Okay, okay, look deep, look deep. Oh, Josephine, wow, very good pair. Do you observe anything? Bling bling, wow, there's a bling bling, you know. I imagine somebody would see, wow, a lot of wrinkles, huh? Imagine somebody would see, wow, the eyes look overused, wow, there's a lot of vein, you know. Our eyes, is it important? It's important, right? We all know it's important. Why is it important? Why? Anybody? See me, wow, thank you very much. To look at our phone, okay? A very good answer. To look at our phone, you know. In Chinese, there's a saying, right? Eyes, I need to use a bit of Chinese. 眼睛是我们的灵魂之外. Everybody knows it. We can switch to channel 8. Okay. It means the eyes is, when we see the eyes, when we see the other person's eyes, we can see through into the soul, right? That's how important eye is. So do you see other people's soul just now? No. Okay. And a big hi to our Zoom audience as well. Okay. Hello. Yes. From the Philippines, I can see Betsy. I can see our Japan partners. I can see our Hong Kong partners. Okay. A big hello. Okay. And also, if you need a Chinese translation in the Zoom, okay, you can switch the channel as well. There's also Japanese translation. I don't know how to say that in Japanese, so the Japanese associate, please take care of yourself. Okay. And we are talking about eyes, right? I have one friend, same age as me, but she lost her eyesight when she was 28 years old. Yeah. And I can still remember when we visit her, when we went to her house, she has nothing to do. Every day, what she can do is just listen to the radio. And until now, I mean, she's still alive. Okay. I'm 42 already. So it's the auntie smile, wow, 42. Okay. It's I think about almost 20 years. She still cannot see and she still stay at home. Okay. And it's through that incident that I realized a lot of time we take things for granted. Okay, we use it every day, you know, we watch our phone every day, you know, we look at so many beautiful people every day, but are we taking good care of our eyes? And I think tonight is so important. So I think everybody who attended physically and also on the Zoom, really give yourself a big round of applause. Okay, why? This applause is for yourself because you care. You care to take the time to attend physically or via Zoom because you know, we have to be responsible for our own health, for our eyes, okay, and also for the people around us, okay. So this series of talk is actually called the Industrial Expert Seminar, IES. It's actually organized by Avita, and Avita has regularly organized IES, Industry Expert Seminar. We invite experts from different industry. Like last week, we just had another IES, right? Who attended last week's session? So what do we learn? Water, okay. So we learn about all ways to take care of our health, because our health, who is the best person to take care of our own health? Lucky auntie very cute. She said you. I was thinking, okay. Yes, ourselves, we are the most important person. And I really feel that we should also give Avita a big round of applause, for organizing all this industrial expert seminar, for allowing us, this chance to learn from all the experts. Okay, so give Avita a big round of applause. And I would also like to take this chance to invite the founder and CEO of Avita, Miss Lee, to come on stage and say a few words. So can we invite Miss Lee?
Okay, good evening, ladies and gentlemen. 伙伴们，大家好。Okay, I'm staying here just once to say thank you to Dr. Juran Chuan. You know how busy is Dr. Juran Chuan? Every time I went to the clinic, want to see him, I make appointment. My appointment is at 10:30, but I see Juran Chuan will be 12 o'clock. You know how busy, so many patients want to see him. So in this so special person, so busy person, come here, have talk for us. So I want to say thank you very much. And one more thing, very special today. Dr. Juran Chuan bring his book. He have 8 books. This is one of his book. He give to everybody tonight here.
I want to emphasize only physical. Zoom people don't have because they might be typing. How can I get the book? Only physical.
So in Singapore, better you come here. Don't at home look at the computer. Okay, come here, have gift. Okay, so here I want to say thank you, Juran Chuan. So everybody will say thank you, Juran Chuan. 1, 2, 3. Thank you. Okay, thank you very much. Okay, so 我不用讲太多, you listen the talk. Okay.
Thank you, Miss Lee, and thank you, Dr. Gerard. And now I'd like to okay, for those who need translation, if you need the translators, okay, now I switch to channel 8. Okay, 我们今天是以英文进行的，所以如果您需要中文翻译的话呢，那您可以现在举手哦。Okay, Dr. Gerard is already on stage already. Okay, but I want to just a short introduction. Just now when I asked him, he has been a doctor for more than 30 years, actually 35 years, right, doctor? Classmate. Dr. Chong. Same year.
Same year.
Oh,
School classmate.
a very close school classmate.
Yeah.
Okay. So how long have she been practicing? 35 years. Wow. Okay. Okay, so without further ado, okay, for more than 30 years of experience, Dr. Gerard Chua.
Firstly, I want to thank Mrs. Lu and Avita for the kind invitation. I've known Mrs. Lu for a very long time. I have a lot of respect for Mrs. Lu and for Avita. Mrs. Lu is someone whom I admire for her vision and her drive. And I admire the organization because I work with Avita during NKF days, and I have always very, very good impression of Avita. Okay, so let's go to the topic. Yeah. So I am an eye surgeon, but I am not just an eye surgeon. I specialize. You want me to speak English or Mandarin? Oh, okay. So no, but I'm bilingual. So I specialize in the back of the eye. I'm a retinal surgeon. So I do all the blinding diseases of the eye, retinal detachments, diabetic retinopathy, age-related macular degeneration, and I do all the complex diseases. So like today, really busy. Suddenly, a banker turned up in the clinic saying that she saw a black spot in her eye. And then she had LASIK done about 20 years ago. She was about 600 degrees before that. And she had an early onset cataract because of her myopia. Because people who are short-sighted above 500 degrees, they have a much higher chance of retinal tears. They get early onset cataracts. That means that people who are above 500 degrees, normally cataracts, they get it at 60, 70, like your father, 75, go for operation. But for them, they get cataracts in their 40s and 50s. Now she's about 40 plus years old, right? 40, right? Yeah. So we operated on her because her power in her eyes suddenly went from, because she had LASIK done, right? So she was seeing quite well, and then suddenly went to 600 degrees. And then the optician said, oh, you better go and see your eye surgeon. So she had an early onset cataract. So we operated on the cataract. And then when we were checking her at the time, we found that the other eye had a retinal weakness. So at the time, we already warned her. We did a laser to protect her retina, and we warned her that this could be genetic. 这可能是遗传性啊. So we said, be careful, this eye, be careful. And true enough, 2 months after cataract operation, she came back today, said she saw a black patch. And then when we checked her eye, unfortunately for her, she had a large retinal tear. So today I had to do an urgent laser for her. And then another, because I do a lot of emergencies. So then just now, there was another lady also operated. She was about 1,400 degrees, one eye, the other eye 1,500 degrees, had early cataracts, multiple retinal tears. So I operated on her, the cataracts, and I did a laser for all the retinal tears. This was about 10 years, 8 to 10 years ago. And today she came, she said she saw suddenly blur in one eye. And then when I checked her, we had a look, she started bleeding in the center of the eye. Okay, it's actually called a subretinal neovascular membrane in the macula and due to high myopia. Now, people above 500 degrees, especially those above 1,000, they tend to get that. Suddenly, they see a patch of darkness in the center. And when we check the retina, there's bleeding in the center of the retina. So for her, we had to do an injection today. Yeah, so we did the injection today. And then to inject a drug to stop the bleeding. And I had to inject the drug every month for 3 months and then control the bleeding. And I told her that it tends to come back. Then about a month ago, we had a young guy. This guy who is a banker also. Unfortunately for him, he went for retinal detachment operation in the government side. And the first operation didn't work. Then came to see us for second opinion. And then unfortunately for him, he redetached. So I operated on him about last week. Is it last week or 2 weeks ago? Yeah. So, you know, he had a major operation. The lens was shaky and the retina redetached. So we had to do a major operation for him. So today I'm going to talk to you about a few topics. The first one I want to talk to you about is diabetes. So now, why is diabetes such a big problem? Because it is a disease of developed societies. Okay, that means us, Singapore. We are a developed society. And why do we see it more now? Singapore has the second highest rate of diabetes in the world. This one, don't be number one. We can be number one airport, number one, seaport, number one, PSLE result, but don't be number one diabetes. Diabetes, unfortunately, is a lifestyle disease. Okay, because we like to eat. Singaporeans love to eat. You know what? I eat, I shoot, I post. Then makan kaki, and then got all kinds of blog posts. Everybody like to see, wow, this one laksa mee, wow, this one wow, peranakan, hey, must go and try. Singaporeans love to eat, and we don't like to exercise. We don't like to exercise. We like to, sian lah, mai kia lah, hey, taxi lah, mai kia lah, mai kia lah. We don't like to walk. We don't like to exercise, but it's really not good for us. Weight gain is one of the big issues. All right. Type 2 diabetes, unfortunately, is a lifestyle disease. Now, 10.2% of Singaporeans, 9.4% of adults above 40 were diagnosed with diabetes in 2019. This is a lot. Now, diabetes is unfortunately a disease that attacks the blood vessels throughout your body. That means that it attacks the blood vessels in your eye, attacks your heart, your kidneys, your legs. Okay, basically, it's a body-wide condition, and we all know that that diabetes, there are many risk factors that worsen diabetes. You can see high blood pressure, cigarette smoking, the diet, cardiovascular disease. And all this will cause damage to all the organs. And the eye is one of them. So they get the kidneys. Last time when we were in NKF, a lot of the patients that required dialysis were diabetic patients, high blood pressure patients. Of course, there were some who were congenital, we call it polycystic kidney disease and all that. But diabetes is one of the big groups of people who get kidney disease, they get eye problems. Okay, now, what happens in diabetes? The blood vessels are all attacked. And in the eye, the blood vessels get attacked. So you can see down here, I just want to see where's the pointer. This one. Yeah. Okay. So these are all the blood vessels inside our eye, the retina, the back layer of our eye. This is the nerve of the eye. In the center here, this is called the macula. Now you see all these bleeding points. Okay. This is damage to the blood vessels and the blood comes out. All right. And this is not a good sign because it indicates there's quite a lot of damage to the blood vessels. Over here, you can see all these yellow spots are actually cholesterol lipid exudates. That means the blood vessel is damaged. All the things inside the blood vessel start to leak out. And this is one of the things that leaks out. And so you can see in more severe cases, this part here, you can see blood, you can see exudates, and the retina, the macula here is swollen. Now, in the early stages, the patient may not have any symptoms. That means they're diabetic. If they don't check their eyes, they don't know. They may have this or they may have this, but the vision is still quite good. So they really don't know. That's why now in our polyclinics, they will tell you if you have diabetes, they will tell you pay $5, go for the photograph. I think it's compulsory. So they will tell you just go for the photograph. All the GPs in the polyclinic, they are now trained to tell you go for the photograph. Yeah, and this will pick it up. And when this is picked up, they'll tell you to go to one of the hospitals, usually Tan Tock Seng, NUH, SNEC, Ng Teng Fong, Khoo Puat. Please go. If you get the letter telling you you have this, please go. Because we can treat you at this stage and at this stage without any serious complications. Okay, at this stage, we can just tell you to control your blood sugar, we will monitor your blood pressure, and we will inject a drug into your eye to stop the swelling. Normally, when I see patients like this, we have got quite a lot of them in our clinic, and I will always tell them, I will need to inject a drug called an anti-VEGF inhibitor into your eye every 1 to 2 months for about 2 to 3 years for me to control it so that you don't lose vision. Of course, when I tell patients that, everyone is like, wow, lao chua leh. Wow, lao injection needle go inside my eye. Yes, the needle goes into your eye. All right, I inject the drug into your eye. But don't be like that lah, we numb your eye lah. We will make sure your eye is numb. We will give you anesthetic so that it's not painful. Nobody wants pain. Even doctors also scared of pain. Okay. So now when the disease gets worse and worse, there'll be more bleeding. And unfortunately, what happens in these cases is they get these abnormal blood vessels that form. These are called new vessels. They look like little worms and they bleed very easily. And when they bleed easily, what happens is that the patient suddenly cannot see. Suddenly they wake up one day, they see a big cloud, a black cloud, there's blood, and they cannot see. And it's difficult for us to treat because the blood is blocking our view. We can't do laser. A lot of times in these severe cases, we need to do laser treatment to laser the peripheral retina to try to stop the bleeding and to reduce the risk of complications. All right. Now, the problem is that when these new vessels, they bleed, they form scar tissue. This is very difficult to treat. I'm a retinal surgeon. I've done about 3,000 retinal detachment surgeries. I've done 23,000 cataracts, 10,000 injections, about 10 to 12,000 lasers. This one, I sweat, okay? Don't make us sweat, please. Please, tolong, don't make us sweat. I always tell a lot of my patients, because I do a lot of complex surgeries, don't make us suffer lah. You make surgeons suffer. It's like you go fly a plane. Hey, hello, I want to go Hong Kong. Hey, don't go Hong Kong lah, now typhoon. Don't care, I booked ticket already. I got my booking.com. Cannot, must go Hong Kong. Hey, you fly in a typhoon, are you mad? No, must go Hong Kong. Hey, you know what happens when a plane flies to a typhoon? So don't make a surgeon sweat lah. Okay. All right, things can happen. Sometimes things are not good, they happen. I know you think, cannot be what? Wow, surgeon so lousy one. Cataract surgery got complication one, man. Of course. If you come to us with a very difficult cataract, a very dense cataract, small pupil, lens shaky, yes, there are complications, no matter where you go. All right. So try to make life easy for the surgeon. So for things like that, when it forms scar tissue, we have to operate on you. All right. We have to do a vitrectomy surgery. It's a very complex surgery. We have to put very fine instruments, cut out the gel, cut out the scar tissue, do a lot of laser, put gas, put oil, very complex, very expensive. Results may not be so good. So try to avoid. Okay, so this is very technical, but it just means that there's swelling. You don't want to get to this stage. All right. I'll just skip this. Now, how do we detect this? A lot of times now when you go to the polyclinic, they actually take your photograph and they use AI. So they actually have special programs that detect all this to save time for the doctors, and they pick it up. And if they find anything, they send you to the government doctors to check you further. So it's actually quite refined now. So when you go to the polyclinics, they actually use a computer program. Okay, it's called Serene. Okay, so in one of our patients, we had quite a few patients. In fact, just recently we operated on her. She was 47 years old. I think 47 around there. Yeah. She one day woke up and she suddenly saw a lot of black spots and she thought something went wrong. And actually, she was sent to me by another eye surgeon. She actually had bleeding in the eye from diabetes. So there was a lot of, So there was a lot of blood in the retina. And she swore to us she was not diabetic. And then later we found that she was diabetic. We scolded her for not controlling her diabetes. And even then now still not well controlled. Very stubborn. But and we operated the cataract. She's only 47 or something, 48. And we did both cataracts. Okay. And we scolded her and we did the laser for her. The blood is a lot less now for her. She can see actually quite well. But we keep scolding her because patients like that, I don't know why. We keep telling her must control. She's like a bit bold, don't want to take her medicine. Very weird, but please don't. Please learn to control. Some things people cannot accept. I don't know why. When we tell some people, hey, you must control your blood pressure, you must control diabetes. No, my father, mother, not diabetic. What? Okay. Nothing to do with them. It's you. So when we tell you something like that, help yourself. Control. I mean, it takes a bit of discipline, but you should. Okay, so once it starts to bleed, it's hard for us because we find it hard to laser. The blood blocks our view. We can't laser. And then at this stage, the only thing we can do is to inject the drug to stop the bleeding. But it's not ideal. Better to do the laser and inject later. Okay, so how does diabetes cause blindness? So again, like just now I told you, there's damage to the blood vessels and the blood vessels will start to leak proteins and lipids, causes swelling. When the swelling in the retina lasts for too long, it damages the retina. All right, the retina is very delicate. You can ask Lei Hua, she will tell you all about it. Medical school days. So retina is very thin, very delicate. It's only about 0.5 millimeter thick. So unfortunately, once it leaks, there's the blood supply, the blood nutrients don't get to the retina as well. So the retina starts to get damaged. And once it forms scar tissue, it pulls the retina off. And once the retina gets pulled off, there's no blood supply. The retina starts to die. So all these things can damage your retina. Okay, so in very severe cases like this, unfortunately, even after operation, they will not see. Okay, so it's very sad, but we had one Malay lady recently. We operated on her, and with the retina is perfectly fine, flat. But she had this before the operation. And so even after we did the operation successful, she still can't see well because of the damage to the retina from the diabetes. Okay, so this is the laser treatment that we do. And a lot of people think that when we do laser for them, we think, oh, after laser, don't need to wear glasses. No, different laser. We have got many types of lasers, all right? A lot of people, when I tell them, hey, I'm doing a laser for you to seal your retina for diabetes, or you have a retinal tear, I'm doing a laser. Hey, after that, must wear glasses. It's not. That's LASIK. Different laser. We have 20 different types of lasers. Just like you got car, sports car, MPV, SUV, lorry, many types of cars. Okay, so we got many different types of lasers. This is a different type of laser. All right. Okay, so a lot of complications can occur. Now, this is the operation that I do. I have a day surgery in my. I got three clinics. One of them is a day surgery center, and I've done about 2,000 over cataracts inside, and we have the machine to do this vitrectomy surgery. Recently, we had another complicated case where we did 27 gauge vitrectomy. So we use this very fine instrument. It's very, very fine. It's finer than a toothpick. You know a toothpick, right? It's finer than a toothpick, all right? So we use this, and together with a light pipe, and there's a fluid infusion, and we remove the gel, remove the blood, remove scar tissue, and we can also do laser. So it's pretty complicated. Okay, so how do we manage diabetic retinopathy? If you have diabetes, please control. Try not to cut out sugars in your diet, exercise, lose weight, don't smoke. Okay, simple things, control your blood pressure. All right. Okay, so just remember early stages, no symptoms, lifelong screening is very important. And patients with type 1 diabetes definitely have to be seen within 3 to 5 years. And people with type 2, you should be seen at the time of your diagnosis. That means that your polyclinic will, if they diagnose you with type 2, they will send you for a photograph. Okay. Now, before I go to the next topic, anyone ask me about diabetes, or before you all forget, or should we have the question after I finish everything? After? Okay. So I specialize in high myopia. So the book I gave to you all is on high myopia. Okay. And unfortunately, people with high myopia above 500 degrees have a lot more issues than people who are not short-sighted. All right. And what are the issues that they get? Unfortunately, they have problems which involve from the front to the back. So they have a much higher chance of early cataract. They have a higher chance of glaucoma. They have a higher chance of retinal tears in the retina. If they are above 1,000 degrees, they have a higher chance of this thing called myopic macular degeneration, all right, right in the center. And that one is very hard to treat. So now we know that short-sightedness, there are a few theories on why people get short-sightedness, but for majority, we will consider that 70% is actually hereditary, 30% environmental. So if you have both parents who are short-sighted, your chance of getting myopia is a lot higher. If you have one parent that's short-sighted, your chance is already higher than a normal person who does not have any parents who are short-sighted. Now, near work, that means that if you are doing a lot of reading, if you're doing a lot of computers or looking at your handphone, for kids especially, we recommend that for children, if you have any kids who are short-sighted, control their reading habits. That means that not more than 45 minutes in a stretch. They must stop. Then look far, far away. When they look far, far away, they are relaxing this muscle here called the ciliary muscle. All right? Because this muscle goes into spasm, especially in young children. So reading, computers, handphone, playing games, whatever, don't let them do it for more than 45 minutes in a stretch. Break it up. If they want to do 3-4 hours, break it up. 45 minutes, 10 minutes rest. 45 minutes, 10 minutes rest. All right? That means 10 minutes, they stop, walk around, look far, far away. Don't let them like 3-4 hours watch Netflix. Don't let them, please. Okay? Okay, so complications, plenty. But just now I mentioned to you already. All right, the one that we worry about, unfortunately, is retinal tears and retinal detachment. Because this one can lead to blindness. And unfortunately, the success rate for retinal detachment operations is about 85% to 90%. There's a 10 to 15% chance we will fail. And you can operate a few times, we can still fail, and you can go totally blind. All right, so it's not like LASIK or cataract where it's 99.8%. So remember that. retinal detachment is complex and there is a failure rate. Always remember that. So if you can avoid it, avoid it. We are always checking people who are short-sighted above 500 degrees. If they suddenly see floaters, don't ignore. Please see an eye surgeon. Okay, we need to look out to see if you have a tear or if you have weakness in the retina, because we can do a laser to stop a detachment. Degeneration of the retina and the macula, unfortunately, there's no known treatment at the moment. Okay, but we'll give you vitamins to take. And we watch out for bleeding in the center. Okay, this is called a choroidal neovascular membrane. All right, if you bleed, we will inject a drug to stop the bleeding, like what I did today. Formation of a macular hole. This macular hole in the center is very difficult to treat for people who are highly myopic. We've done quite a few operations for them. They are about 1,400, 1,800 degrees short-sighted. They form a macular hole. The macula starts to detach. We actually have to operate on them. Operation is tough, and the success rate is not as high because of the short-sightedness. The back layer of the eye is not functioning very well. The pump at the back of the eye doesn't work as well as normal people, so it doesn't stick together very well. Okay, and they have an increased incidence of cataract and glaucoma. So you do need to check for that. So remember that people above 600 degrees or above 500 degrees have a 300 to 400% higher chance of getting a retinal tear, retinal weakness, and retinal detachment. Okay, so people who are short-sighted, and if they tell you they suddenly see floaters and flashes, and they go and check on Google Doctor. Oh, Google Doctor. Oh, yeah, Google Doctor. Oh, very common. Don't worry, don't worry. Please worry. All right. If you're above 500 degrees and you get see floaters, please go and get it checked. If you're not short-sighted, there's no family history, usually is okay. That's just age-related degeneration of the vitreous gel. Okay. All right. Degeneration of the retina due to high myopia, it looks like this. Normally, this part here should look orangey, not yellow. All right. Yellow means that it's not healthy. Okay. So there's no known treatment for this, unfortunately, but we will look out for bleeding here. If they bleed here, we inject a drug to stop the bleeding. Okay, so yeah, let me just go past this. Okay, yeah, this one, I've done a few operations for people who are very short-sighted, but it's tough. Sometimes you do the operation, they don't recover much vision. Okay, now glaucoma. A lot of people don't understand glaucoma. Glaucoma is like high blood pressure inside your eyeball, okay? And when the pressure is high, it damages your nerve. And the nerve, once it's damaged, because the nerve, inside the nerve, there's a blood vessel. When the pressure inside the eyeball is high, this is the blood vessel here. When the pressure inside the eye is high, the blood is supposed to be pumped into the rest of the eye. The blood has to be pumped against the pressure. The pressure is pushing it, preventing the blood from entering. So once the blood cannot enter the nerve will slowly die. Now, it's important that for people who are above 500 degrees, they should get the eye pressures checked when they are above 40 years old. Just check your eye pressure once every year. Early cataracts, they get early cataracts, okay? And surgery in such patients also technically a little bit more difficult. Okay, it's a technical issue for us, but can be done, can be done. Okay, now, okay, so you can see these are pictures of cataracts when the lens turns a bit brownish, yellowish, and the white patch, white lines. These are all the different types of cataracts. Okay, now before I go to the next topic, cataracts, anything? Shall I just finish everything? Okay, finish everything. Okay. All right, cataract, simple. All right, cataract, common. Okay, in Singapore, they studied the Tanjong Pagar population, 1999. They found that 90% of people at 60 years old get a cataract. Whether it is a lot or little, when we examine your eye, we will see a cataract. Okay, so 90%. By the time you're 70 years old, almost 99% will get a cataract. When we check you, we'll see it. Whether you are affected by it, that means that you're very happy with your eyesight. No, I see very well, I see very well. But when I look at your eye, I will see the cataract. Okay, that means that you already have a cataract. But you're actually okay. No, I don't do anything. I'm very happy. I'm very happy. I drive, I go play mahjong, I go dancing. I don't need to, I'm not worried. Okay, sure. Cataract not urgent. Okay. But I look into your eye, I video, I show you, this is your cataract. I will see your cataract. But whether you want to do anything or not, it's up to you. Cataract surgery not urgent. All right. I will always ask you the question, does it affect your life? Does it affect your work? If it doesn't affect your life, doesn't affect your work, wait lah. Don't worry. All right. But these are the symptoms of cataracts. You may see vision blur. And then in the certain types of cataracts, when there's a white line or white patch in the center, they see glare. That means that at night when they're driving, 很刺光, they see glare. Sometimes they see like rings around the lights and all that. Huh? And the colors also start to fade. They may even see double vision. We had one patient that came to see us and he told us he saw 3 things. So it's not ghost man, so don't worry. But he saw like three objects because of the cataract. Right? It split up the light. And especially at night, certain types of cataracts cause worse vision at night. Now, what they found is that several studies have shown that in dementia patients and patients who are what you call on the elderly side above 70, 80 years old, vision is very important for the quality of life. That means that you don't want them, especially dementia patients, to also lose their vision. They really start to lose their mind, okay, because they can't see also. All right, so it's important. Vision is quite an important sense, one of the senses that is important for not just daily living, but also for mental. So for patients who definitely have early dementia, you probably want them to get a cataract operation earlier so that at least they can see clearly. Patients who unfortunately also start to have, for example, diabetes, high blood pressure, there's some heart issues, have the cataract earlier than later. Because when things start to go wrong, when you start to have heart failure, or when you get a stroke, or when you get cancer, we can still do the operation, but the risk is higher. It's always good to do the operation when you're still quite strong, not too old. Because when you're old, we also get worried. Sometimes we try not to operate on people above 90 years old. Sometimes we are forced to do it, we'll do it, but we try not to because the risk is very high. Because when something goes wrong, if the patient after the surgery is resting, the patient gets a heart attack because he's 92 years old, family all get angry at you. He killed my father, killed my mother. But he's 92 years old. All right. And we always get an anesthetist to stand by just in case. But he's 92 years old. Okay. So there have been a few cases where patients have died in the government side. They were just resting after the surgery successful, but they actually had heart failure and they died. And of course, everyone gets angry. But they are at age, they have the risk factors. You understand? It's like flying to Hong Kong when there's a typhoon, plane crash, you get angry. But why you go and fly during a typhoon? Okay, so when you're quite healthy, try to settle all the small things. Okay, now there are many different types of cataract surgery. But the common one now, which almost all of us do, is called phaco. And this is the one that we do through a small incision. All right. Now, a lot of people always ask me the question, laser. Okay, because they hear the advertisements. All right. There is a type of laser, there's a type of surgery where we call femtosecond laser assisted cataract surgery, or called FLAC, FLAC. All right, but actually the laser doesn't do the surgery. The laser just makes the openings. So when we do the surgery, let me see if, oh, okay, I didn't put a video. Okay, so when we do the surgery, we make a small wound. The wound is about 2.5 millimeters, 2.2 to 2.5 millimeters. And then we put in very fine instruments to create an opening. Then we put an ultrasound probe to use ultrasound to emulsify the lens. Then we suck it out. Now, when they do the laser-assisted cataract surgery, they use the laser to make the opening into the eye and the opening into the lens. But the rest of the surgery is done with ultrasound. So it's still ultrasound. All right? It's just like if you buy a car and then you pay $10,000 more for the door that swing up. Actually the door you can open yourself. But pay $10,000 more. Surgeon very happy, we're all very happy. So, but not necessary. Okay, so I think this is my last slide. Okay, any questions? Yeah. Yeah, go ahead. You need a microphone?
Well, I have been advised by my doctor to go for cataract operation. But my friends were suggesting, hey, since you are doing cataract, why don't you do your astigmatism at the same time?
Okay.
So what's the opinion
No,
about
no, no.
this?
What you must remember is this. There are many different types of lenses that we put into your eye at the time of cataract surgery. And these lenses have different functions. I'm sure some of you have read. Now there's a lens that can see far, see near, called multifocals. We also have a lens that we call the trifocal. We also have this lens called extended depth of focus lens, the EDOF lens. We have a lens that can reduce your sanguang, called toric lens. Then we have the normal lens called the monofocal. Now, a lot of times people always ask me that question, but I'm a retinal surgeon. So you must remember when I talk to you from a retinal surgeon's perspective. All the patients I do are all complex, all blinding. Most of the patients who come to see me, I do get normal patients also, but a lot of the patients that I operate on all have some retinal problems. Okay, that means that they had a retinal tear, they have age-related macular degeneration, the eye is not normal. So for them, almost for sure cannot put the multifocal lens. The lens that a lot of people talk about now, can see far, see near, the multifocal, 看远看近老花都没有that is called multifocal. All right, that one I've done 23,000 cataracts. I only put in 500 of those because most of my patients all have problems. I deal with all the problematic patients. I do get normal ones, I do, but not many. All the patients who come to see me always usually have something like diabetes, high myopia with retinal tear. I just get those patients.
Okay.
So that's my pool of patients. So I've done multifocals, and what we always would tell patients, multifocal lenses by right should only be implanted in people who have normal eyes. That means that you must not have anything wrong in your eye. No glaucoma, no retinal tear, no diabetes, no age-related macular degeneration. By right, that should be the criteria. But I know that there are surgeons out there who implant it. They don't care. They just implant. The problem is, if nothing goes wrong next time, everybody happy. You're happy, surgeon very happy, a lot of money. But if you get retinal detachment, if you get age-related macular degeneration, and you have a multifocal lens, troublesome. Troublesome for the surgeon. Troublesome for you. You'll get a lot of distortion. That's the problem. And multifocal lenses have complications also. 80% are happy. 20% not happy. And we don't know who the 20% are. Unfortunately, we have a machine in my clinic that can give me a rough gauge. It's actually called a wavefront analyzer machine. It costs $50,000. And I will do it for patients who want the multifocal lens. It's supposed to pick up certain aberrations of your cornea. Okay? So we are looking out for third order aberrations, second order, third order aberrations. This give a lot of distortion, especially at night. The people who put multifocals are always unhappy at night because they see a lot of glare, a lot of halos. And to pick it up, you actually need to look for third order aberrations. And that's a bit complex. But generally, I always tell my patients, multifocal lenses, not everybody's happy. If you are willing to accept 80% for far, 80% for near, small things cannot see, then we will do it for you. But if you are one of those very fussy fellas, I want to see golf ball. Then after that, I want to see my handphone, my friend SMS, WhatsApp to me. I want to see the small thing. Hey, please, don't do that. You torture us, you torture yourself every day, sit outside my clinic. Well, no, why you like that? Why I still cannot see so clearly? Don't. Okay? Because you must understand yourself. All right? Now, you're talking to me about the astigmatic lens. Astigmatic lens is called a toric lens. And we will do a special test to determine whether you're suitable for the toric lens. And there's a special formula which we will use. And we'll calculate what axis to correct your astigmatism. Just remember that it's not 100% accurate. We can reduce your astigmatism 50% to 60% by half. 20%, we can reduce it by almost 75%. And 20 to 30%, we will reduce less than half. So we will tell you the statistics. That means that we'll tell you, hey, you know, you pay $600 for this lens. This lens is twice, 3 times the price of the normal lens. The normal lens, the monofocal lens, costs only about 200 plus. But the toric lens, the Sanguang lens, costs about 600 to 800. So I will tell you, I do this for you. You want that lens, I will reduce your Sanguang by about half. 50 to 60%, I can reduce it by half. Are you willing to accept that? Because some people say, oh, no, pay so much money, still only half. Oh, no. Okay, I mean, I'm very frank. I tell all my patients, well, when you come to my clinic, when you want to do the operation, I sit you down. We do a video. I'll tell you everything. I tell you the risk of blindness. I tell you the risk of this complication, that complication, that complication, that complication. At the end of it, I'll tell you, do you understand? Because we video it. Because I want you to understand before you decide on anything. Sometimes patients are like, I have one patient, a pastor, a missionary. After I told him all of this, he walked out. He said, huh, got so many complications. I said, yeah, lor. Hey, not everybody go heaven. Yeah, I mean, you know what I mean? Wow, God blessing, give money, blessing. Hey, not everyone go heaven. Huh? So same thing lah. I will tell you, you do the operation, this is your success rate, 99.8%. Risk of blindness, 1 in 8,000. Chance of this complication, I touch the posterior capsule, membrane rupture, surgery take very long, very complicated, still cannot see well, 3%. I'll tell you everything. At the end of it all, this doctor, no confidence one. Oh no, tell me until like that. Other clinic don't do that. Okay, up to you. You go. Okay? Because to me, I will tell you. Because that's my duty. My duty is to inform. Okay? I'll tell you. You come and see me, you got retinal tear, retinal detachment. Like I told that guy, that fellow who came, the banker who had a retinal detachment, operated in another hospital, failed, then came to see me, and very complicated story. Then finally operated. So I told him the success rate 80%. Huh? 80% only. I said, yeah, 20% fail. Get scarring. Then go blind. Yeah. I tell him like that. Because my job is to be honest with you. So I will tell you. Some other places will tell you, how are you so scared? Do lah. But when things go wrong, I tell you, everybody face black. So I will tell you. So when you put that Sanguang lens, it's not 100% no. I can reduce it in about 60% by half. 30%, I'm actually not bad. I will reduce 75%, then you're very happy, I'm very happy. 20%, I reduce by less than half. So these are the odds. Yeah.
Okay, Dr. Gerard, there's still a few slides.
There is. Oh, okay. Oh, okay. Okay, all right. So, yeah, this is the latest method. We make a small wound. After doing this surgery, a lot of times the patients will always ask me the same question, same thing. So I always tell them, after this surgery, tomorrow you can cook, you can carry heavy thing, you can bend down, cough. Can bend down and cough? Can. Can carry heavy things? Can. Why my friend say cannot? Your friend specialist? Huh? No, I mean, you should listen to me, right? So you can do all that, but forever cannot rub eye. Forever. Do not rub your eyes. All of you here, if anything you want to remember about my talk, do not rub your eyes. Rubbing your eyes, the latest research, go and Google this. Rubbing eyes can lead to retinal detachment, early cataract, and glaucoma. Go and read, okay? Go and Google tonight. Those of you, Google. Rubbing eye, retinal detachment. All right? This is the latest finding from last year. Don't rub your eyes. All of you. Don't rub. Eye itchy, use eye drop. Go and buy eye drops. Okay? Don't rub. And so after the cataract surgery, no rubbing. No rubbing. You rub, the lens can drop. Don't rub. Okay? You can carry heavy things. You can exercise. Go. Can run, can go and carry weights, all that, can do that. But no rubbing. Okay. All right. So for you, I'll always ask before you do the surgery, whether you want to do it under local anesthesia or whether I do it for you under sedation. We can do both for you. What's the difference? Price. Okay? It's true. Sedation is where we give the drug and then you're asleep. Local anesthesia, I give an injection and then you're awake, but it's not painful. So some people cannot take it. Some people very kanjong. You know, they're like, oh, put me to sleep. But there's a cost, because I need to hire anesthetists. So the anesthetist will come to the clinic, give the drug. When we're doing the surgery, you then finish. Operation over. Yeah, over. Okay. So there's a difference. The cost difference is about 1,000. So I mean, that's life, huh? Because the anesthetist you have to pay for him, right? Okay, so yeah, so this is my machine. I have the latest, the Centurion. Okay, never mind, this is very technical. Forget it. Okay. So yeah, then the lens we use special plastic. All right. It's the many okay. There's polymethyl methacrylate and all that. Don't worry very stable. It'll last 100 years. Okay, so don't worry. All right. So again, just now I was talking to you monofocal, multifocal. Just now I explained to you all multifocal. Not everybody is happy. Just remember that. If you're the very, very fussy type and only you know, please, you think I see you for 5 minutes, I know. Hey, please don't be like that. Your husband, your girlfriend, your boyfriend, if you are trans also, never mind, whatever. They'll know you better than I know you. I see you for 5 minutes. So sometimes I'll ask you a question. So are you the sort that really everything will be very clear? No, I very chin tight. But look at him, I'm like, I don't think so. So makes me suspicious. So to me, I'm like, this character, I think better not. Okay, because you know they'll give you problems. Okay, so again, this just now I was talking to you just now, the one about the San Guang one is called a toric, okay? And we can correct your San Guang, but just remember it's about 60%. I reduce by half, right? Yeah. So it's up to you to decide whether it's worth the money. Yeah. Okay, so after that, multifocal, again, just remember 80% far, 80% near, all right? Don't go and expect, now I want to see far, I want to see that little bird. Then near, that little spider, I want to see clearly. Don't, please, don't torture us. Okay, so now this is the latest multifocal lens. You can see all the rings. When I look at your lens under the microscope, I'll know whether you have a multifocal. I see all these rings. But there's a new type of lens called the EDOF lens, the extended depth of focus lens, where I do not see the rings. And that lens has less chance of halos. Okay, but that lens is not a true multifocal. It gives you only intermediate distance or intermediate. It gives you only partial extended depth, but it's not true multifocal, called EDOF lens. Okay, let me see. Okay, disadvantages again, I was telling you about the glare and halos at night. Right. Okay, so patients who have any eye disease, basically, if you have any eye disease before, your eye should be totally normal before we do a multifocal. Just remember that. People who have LASIK also strongly discouraged from multifocals because they get glare and halos at night. Yeah, and they're very unhappy people. So, okay, no, don't talk about this. Okay, complications. There are many complications, many complications. Last few weeks, I've been operating on all the complicated cases. Walao, jialat. Just yesterday, we had one Indian lady, difficult one. Last year, because she's on this drug that she was taking she had urinary incontinence. So she was on a special drug. And that drug causes complications for cataract surgery. The pupil is small and the iris is very floppy. And when we do the surgery, wow, very tough. So after that surgery, wow, I was traumatized. I was very traumatized because I had to do it very slowly. And it was done in Camden Medical Center. There's a Novartis operating theater. So I remembered it. So I wrote down inside the notes. Luckily, it went well. It went well. No. Those cases are very prone to complications. When we see a floppy iris, it's well known to have complications. So I told her, I said, ma'am, you know your eye was very difficult. No? So this time I do your other eye. I give you this special drug. So I gave her this special drug to apply the day before operation and on the day itself to apply, just to avoid that complication. So yesterday we operated on her. Yesterday or the day before? Yeah, I remember. So, wow, smooth. Wow, so the drug works. The drug works. So actually, I'm writing to SNEC to let them know to try this drug for this type of complication. Yeah. So far, nobody has really talked about it yet because that complication is not that common. Okay, so let me see. Major complications. I don't talk about it. MCM. But I handle all of them. Okay. Now, just remember, a lot of people, after I tell them after cataract surgery, I tell them, hey, you can exercise. Oh, very good. Okay, good. You can cook. No? Wow, can cook. Can bend over and cough. Oh, good. Don't rub your eyes. Cannot rub. Don't rub lah. And then the next time I tell them, your eye will be dry. Women get dry eyes for very long after cataract surgery. Always remember that. Women get dry eyes for very long. Okay, men after 1-2 months, they are okay. Women, 3 to 6 months, based on research. All right, please. Okay, this is hormonal. I know it's not fair. One like that. You already give birth already. Suffer so much already. Now after cataract surgery, suffer some more. Hey, not fair lah. The world is not fair. All right, but don't forget, women, especially after cataract surgery, you all suffer more. Your eyes are drier for longer. 3 to 6 months. Please put drops. Please put drops. Okay? Some people, die, don't want to put drops. No. Smudge my mascara. Don't want. Right? Please, you all already can exercise, can cook, can do this, can do that. Put drop. Hey, put drop. Don't like that. Simple thing, just do lah. Okay, please. So that your vision is clear, you're comfortable. After the surgery, you don't think, wow, doctor bluffed me, something went wrong. Wow, now painful, red, tearing. I think he got complication. Don't want to tell me. This doctor not honest one. Hey, put drops lah. Y'all terrible. Simple thing. Now they always ask me, got anything cannot eat or not? Can eat crab or not? Can eat prawn or not? Can eat sotong or not? Eat lah. Yeah, not Chinese sincere, please. Just eat. Mian kia, okay? All right, so don't worry, all right? Prawn, sotong, crab, all eat. Okay. Eat allergen. Okay. 我的好朋友嘞 you all don't laugh. Okay, so any questions? I think come to the end.
I want to know the glaucoma 青光眼
青光眼
为什么会发生青光眼
Okay.
And then another question is can be cured or not?
Okay.
Okay, for the benefit of the Zoom, why glaucoma happens and is it curable?
Glaucoma, unfortunately, do I have a talk on glaucoma? No, somewhere in the slides. Yeah, glaucoma or 青光眼 basically is when the pressure inside your eyeball is high and it damages your nerve. Okay. There are 2 main types of glaucoma, open angle and close angle. Majority are the open angle, 开角型的啦, and mostly genetic, runs in family, 是遗传性的，一大部分是遗传性的。Okay. Yes, 有些是跟高度近视有关系，有些是我们说是外伤，可是一大部分是遗传。Large portion of glaucoma is genetic. Some are due to high myopia, some are due to diabetes, some are due to trauma. Majority of open angle glaucoma, which is the common type of glaucoma, is genetic, runs in families. So if you get glaucoma in your family, I know people always tell me that. 没有嘞 Then I'm like, 这个是遗传性哎，没有嘞，爸爸到90岁都没有戴眼镜，妈妈到90多岁都没有戴眼镜，可能是你的武功失仪。Because I ask you a question, I'm sure you all know, right? Sometimes your friend, Ati and Lily, she's so short, the son so tall. I think Lily sleep with someone. 不要乱讲话了，你废话了。是他的四功很高啦，你忘了doesn't mean that your father mother very short or your father mother not clever, you cannot be professor, no. You understand what I'm saying? Yeah. So genetics is very peculiar lah. Okay. What we do know is that it runs in families. So if you got glaucoma, if you like your family, tell them lah. Really, they should go be screened. You should tell them because you got no symptoms. Yeah, glaucoma, unfortunately, is called a silent killer. No symptoms, no pain, no redness, no blurring. And by the time you have symptoms, it's very late. The nerve is almost damaged already. and there's nothing much we can do. It's irreversible. So glaucoma, the best treatment is early detection. And glaucoma cannot be cured. We can control it with eye drops. There we can do surgery, but we try not to do surgery for life. Sorry?
Get the same case.
Usually, yes. One eye will start first. Usually the other eye will follow. Yeah.
Hello, Dr. Chua, can I check with you? So what will you recommend us do the eye checkup every year, even though without any syndrome?
Okay, the recommendation, WHO recommendation, above 50 years old. But if you have a family history of glaucoma, if you have a family history of retinal detachment, retinal tears, if you have diabetes, you should be checked above 40 years old. Yeah. But if you don't have any of those, above 50 is okay. Yeah. Just go government. Go government, polyclinic, get an appointment. Yeah. Private, expensive. But you want to come, we'll see you. Yeah. No lah, not 2 hours lah. You don't come at the time when we are really, really busy. Come in the afternoon, late afternoon, not so bad lah.
好像刺刺的，有时候这样刺一下。
那个是干眼症。干眼症呢有很多病症啊。So dry eyes has many symptoms. 干眼症平常女人是比较快，40岁女人就开始有干眼症，男人平常是50岁到60岁，而且女人荷尔蒙很大关系。Hormones play a big part for dry eyes for women. All right. So the symptoms of dry eyes, like what you mentioned just now, the many symptoms of dry eyes. A lot of symptoms are like, for example, some sand in the sensation in the eye, like a bit like something in the eye feeling. Your eyes get tired. Sometimes there's a lot of backside discharge, turns a bit red. Sometimes the vision gets a little bit blur. Those are all symptoms of dry eyes. Yeah. And dry eyes, very simple. Just go pharmacy, buy the normal drops. Just tell the pharmacist you can buy. Don't have to see eye doctor, but you should put. Yes, you must control it lah. At your age, maybe 4 or 5 times a day lah. About 4 or 5 times lah. But once you are above 50 to 60, maybe 5 or 6 times. 60 to 70, maybe 7 times, 8 times a day. Yeah.
Sorry,
Yeah.
just on top of that question, will people overdose of eye drop? Like if I put too much of eye drops?
Not for dry eyes. Yeah, not for dry eyes. Dry eyes, those are lubricant drops.
Okay, doctor, I'd like to find out.
Okay.
Iritis, occurrence of iritis, what causes it?
Yeah.
How to prevent,
Iritis,
and
okay.
how does it lead to complications?
Iritis is a very specific topic. Iritis, okay, let me see if I got a picture of the eyeball. What is iritis? Well, this is a very specialized topic. Okay, let me get the eyeball. Okay, this is the eyeball. Okay, iritis, there are many types. Okay, iritis is basically, when we use the term iritis, this is the iris. Okay, basically it is inflammation of the iris, and usually it is the front part of the eye here that gets inflamed. And it's a very specific condition. It looks like sore eyes, but it's not. The inflammation is inside the eye, and when we check you, we see cells in the eye. It is a very specific condition, not common, okay? There are many types of iritis. 60% we don't find a cause. The remainder 40%, the common cause usually is linked to this condition called ankylosing spondylitis, HLA-B27. And they usually have backache, and they usually have, they also have hip pain. They may get heart issues. and they get inflammation in the eye. The other causes of anterior iritis or anterior uveitis would include, not that common, but TB, syphilis, and there are what you call a whole range of other conditions that can cause it. So in complex cases, we have to do quite a lot of investigations. Yeah. Complications. Yeah, it causes early cataracts, glaucoma, and if you don't control it, it can actually cause what you call, it can even damage the iris, and the cataract that you get is a very special type of cataract and glaucoma. Yeah.
Hey, Dr. Cha, I wanted to ask, for people who experience floaters, how big a concern is that actually?
Okay, like what I said earlier, floaters is actually degeneration of the vitreous gel. It's common if you're above 40 years old. But we only worry when you have certain high risk issues. That means that if you're above 500 degrees short-sighted, if you have a family history of retinal detachments, family history of unexplained blindness, don't take floaters lightly. We need to check your retina to see if you have a tear. But if you don't have any of those, most of the time it's harmless. It's like, for example, somebody asking you, doc, here, what's that out here? Don't worry, stress, go and sleep. But then you don't know that he actually, father died of heart attack, uncle died of heart attack, grandfather died of heart attack. He could be having a heart attack. But generally, a lot of us also get chest pain, right? True or not? You see Lee Hsien Loong, Lee Hsien Yang fight, you also all xin tian. Right? You see Redoubt Road, you xin tian. Okay, I never go SLA, go and rent bungalow. You xin tian. Okay. Hey, don't quote me, Boffma. Joke, cannot, joke. Okay. Yeah.
Doctor, I have two questions. One is that you mentioned about eye drops.
Yes.
I recently had my cataract for both eyes.
Okay.
Any brand of eye drops?
Okay. When did you have your cataract?
Almost coming to 2 years.
Any brand, okay, no problem.
Any brand?
Yeah. If it's 2 years, no problem. If it's 1 month after cataract surgery, no. You need to get a special type.
Okay. And then how often do I have it? Every morning to apply the eye drops, or what's the frequency?
I was just about to ask you how old you are.
How old do you think I am?
Big Salagen.
How do you guess?
No, you
Okay.
Normally for women, unfortunately, your dry eyes is usually a lot worse. Once a day is not enough. You need to put at least 6-7 times a day. Yeah. But if you take Salagen, once a day is enough. Yeah, sorry, anything? Yeah.
Dr. Chua,
Yes.
I'm being diagnosed with retinal detachment, but fortunately, the doctor claimed that it's it's a ORD, so it's some very long time ago. So I recall I did have an eye injury when I was about 8 years old.
Usually not linked.
Not
You are very high myopic, so that
Yes.
is the risk factor that you have.
Yeah, but it went down to when I was in my 30s. Actually, the degree went down. I was very happy. But once it come up, it's very scary. Every year increased by 500.
You probably have
Yeah.
a cataract. You probably have a
Yes.
cataract. Please go and see your
Yeah.
surgeon.
And because of my ORD, it was it was in 2019. I'm supposed to do the cataract surgery.
Why did
but-
you do it?
My mom was admitted to the
okay, sorry.
nursing home, so I actually asked for a defer of 6 months. And then when 6 months come, it was just the beginning of our COVID,
I see.
the circuit breaker. So
Okay.
the doctor actually advised. I went through SNEC,
Yeah, they're good.
and the specialist doctor told me that because of my ORD, she don't advise me to do the cataract surgery. The best is don't do for my whole life. So actually, yeah, it's a old.
Okay, I don't know enough of your history and I haven't checked your eye. To be fair, no, to be fair to SNEC, because I know those guys at SNEC. I used to work there. They're good lah. So maybe you misunderstood them. To be fair, you may not have understood her or him. Generally, if you had an old retinal detachment, I do not know at what stage it is. If it has already absorbed and has just pigmentation, you should check the other eye, make sure you don't have a tear, and do a laser before you do cataract surgery. And you should go ahead with cataract surgery. You should. Yeah, you should. Don't wait any longer. Yeah, because surgery gets a bit harder the longer you wait. No, you should do it. Yeah, just go and do it. Just go and do it, really, I'm serious. Don't drag it on because the surgery gets harder and harder. No. No. You should just go and do it, really. You should just go and do it. Yeah, she can come over lah. Let me have a look lah. Don't like that lah. Yes.
OK， Dr. Chua， 有一点问题
对
请问你了哈。
可以。
一般有白内障的人，发现白内障到需要手术大概多久
？OK， 这个是看你的生活要求了。因为很多人他们早期白内障，他们还是相当舒服、相当快乐，因为他们觉得，哎，我还可以嘞，我驾车还可以嘞，我做工还可以看到电脑嘞。可是医生跟我讲我有白内障，哎呀，我很怕嘞，我不要了，我不要。你自己决定了，因为我的看法是，白内障手术不是急性，是看你生活要求了。可是很重要就是，我们不只是看到你生活要求，我也是看你的身体健康。因为这种的手术对我们说是小手术了，很快啊，15分钟就做完。可是因为很多人做眼睛手术啊，他们有一点急性哎，一点害怕。如果你有心脏啦，还是血压高啦，危险性是你可能会中风、心脏病。所以虽然是小手术，可是还是有冒险性。所以最好是你相当健康，还身体没有什么大事，解决这些小的事情先呢。
OK， 所以，
Sorry, just now Miss Lee asked from discovering cataract to operation, normally what's the period of time, of years or months? So Dr. Gerard Chua answered, actually he has mentioned in his talk just now, it depends on individual. So normally what he asked is, how are you, is it affecting your life, your work, etc.? But get it done as early as possible, because the younger and the better your body condition, actually easier to do the operation. And cataract is a very minor operation.
It is a minor operation. And you want me to speak English or Mandarin? English, okay. It's like the other day I operated on one of our big businessmen in Singapore. He is not that old, no? He's about 58, but he's got an irregular heartbeat. Okay, and he went for 3 operations to solve the irregular heartbeat. We call it atrial fibrillation. That means the heart rate sometimes fast, sometimes slow, sometimes fast, sometimes slow. And all the 3 operations to settle this failed. So actually, I could have operated on him in my day surgery center, but I chose not to. The anesthetist also said, don't bring him to hospital. Because the danger with that kind of heart rate condition is that they can become this condition called rapid AF, rapid atrial fibrillation, where the heart rate suddenly goes up to 200, 250, you know. And that one is serious stuff, because he can die of heart failure. And we need to bring him to a hospital so that in case that happens, we have all the drugs to control it.
But that is a special case.
Special case.
Much.
对。
My mother-in-law is 96, 96岁了，你跟他开了白内障都没事。
对咯。
Yeah, my mother-in-law 96 years old, 做了白内障都没事啊。
对咯，我是
你做的
我做的，可是我有一个病人呢，98岁，他是一个潮州的大老板。他是那时候20年前，他是我们的仪器啊，那些都是带进来新加坡，很大的生意。They bring in all the shark fin, abalone, all that. The son is a doctor. The father waited until 98 years old. I operated on him, the son sitting next to me. Even I also want to faint. No, the patient faint, I faint. And then we got anesthetists, got cardiologists, everybody all down there, big show. Walao.
So
don't,
我的哦，你最久的培训多久了？你才开刀？发现到开刀最久的多久
5年。
？5年吗？
5年。
不是，你看我13年了，你都没有叫我开刀。你叫我的白内障13年了，你都说不用开刀。
是哦。
所以你最久的是
你是
13
特
年。
别了。Cellulose。
Yes，这真的是神人君。我跟你说，我发现我们的伙伴眼睛问题还蛮多的。我相信哦，我们的眼睛问题的人越来越多，而且因为我们每天看手机、看电脑，对不对？熬夜又看电视、追电视剧 ，OK， 所以我会建议检查一下你的眼睛。Dr. Chua 有一个要求嘞。你不答应也可以啦。我们的 member 去检查有没有 discount？ 我现在发现很多人需要嘞。对不起啊，没有跟你商量。你可以不答应？
可以了。
可以吗？
可以了。
那个医药费是一定要的啦。可以，
我会给 discount 了。
可以 discount 哦。听到你们去 register 的时候 show your member card，OK？ Avita 的 member card 啊？
有 Avita card 啦 ，got 啦，有 got。
我们的 member
Okay, I bring a box of Cellulose show me 啦。
Okay. Please, one of just now she was mentioning. Actually, the question is between discovered cataract until operating. What's the longest time for Dr. Gerard among his patients? Actually, it's Miss Lee, 13 years. Okay, still he mentioned the longer time is 5 years. Actually, it's 13 years. Till now, still haven't operated. Okay, so it's Cellulose. Yes. Okay.
Just one question.
Yes.
Is there a possibility that there is no, but is it everyone will get cataract? There will be people that won't get cataract.
No, you live long enough, you'll get cataract. We check you, we'll see it. Our video and show you also. You cannot run away. It's part of aging.
Okay, last two questions. Okay.
Okay, so Dr. Chua, you mentioned that dry eyes is teary, that dry eyes.
Yes, it's
Very
not the same.
serious tearing. Because
Okay, if it's very serious tearing, now there are different types of tearing. Okay, it's outside my specialty because it belongs to a group of eye surgeons called oculoplastics. I'm a retinal surgeon. Now, the tearing, if it's continuous and it has got no symptoms but just tearing, you have to go and see an oculoplastic surgeon to exclude a blockage of this duct here called the nasolacrimal duct. Okay, that occurs in certain groups of people. That means that people who had injury, people with a certain facial type of structure, people who went for plastic surgery, so they get that.
okay, because I had my multifocal done last October. So initially it was okay, but lately it's like keep tearing. Everybody tell me, say, don't cry lah. So I say, hey, I only tearing. Then some says dry eyes. I say dry eyes, but it's tearing.
No, dry eyes tearing is a symptom.
So it's a symptom.
So I suggest you put more drops.
Sorry.
Put more drops. Put more drops. Put more drops hourly and see the tearing gets less. Once the tearing gets less, your comfort level is better. You slowly cut it down from hourly, cut it down to 2 hourly. And if you're still comfortable, cut it down to maybe 5-6 times a day. You determine what is the minimum level of eye drops to keep you comfortable.
Okay, thank you, Dr.
Yeah.
Hi, I just want to ask 2 questions.
Sure, Leo.
As a GP,
Yes.
because all these people will become my patient. Well, I retired, so not my patient anymore. but first, I know it's not in your field, but what is your opinion of intraocular contact lens implant? These are all the young
I know.
girls who do not want to wear glasses.
Yep.
Secondly is I'm seeing a lot of patients now who are 45, 50 years old. just when the long-sightedness
Yes.
starts to come in.
Yes, Lao Hua, yeah.
And yeah, and then they were like, I can't wear my usual contact lens now. I have to, and they will always come to me and say, can you please refer me to eye surgeon? I'll do cataract.
Ah,
And so
okay.
it gets done. And
Yes.
then they don't have to wear glasses for the rest of their life. So that becomes a perpetuating thing, which I do not encourage, but it's happening. So
I know
what's your
it's happening.
opinion? Yeah, thank you.
You're right, it's not in my field. That is under the cataract surgeons, refractive surgeons field. And what happens is this lah. So those cataract surgeons, they like to put in multifocals. Okay. And what they will tell the patient is that it gives them spectacle freedom. It's called refractive cataract surgery, but it's actually just cataract surgery, same as what I do, cataract surgery. Refractive cataract surgery is not a specialty by itself because the surgery is the same as what we all do for cataracts. But they call it refractive surgery because it's done for people with minimal cataract. That means that people who are in their 40s, like what you say, 45, get Lao Hua. Don't want to wear, don't wear Lao Hua. People think I'm very old. Okay. I do the cataract surgery for you. I put this lens for you, the multifocal. Now, like I said, 80% are happy, 20% are not. So these are studies. These are worldwide studies. So when you tell them, you got to tell them everything. That means that you must tell them these are the possible complications. That means that you may not be very happy because for far you only see about 80%. Near, you may not see the very small letters. And you have to show it to them, no. I think the key thing is to under-promise. Under-promise. Because we can't tell who will be unhappy. That's the problem. Yeah. But, the world now is very weird, Lei Hua. You understand? I mean, like, it's actually a form of cosmetic surgery for eye. And it's hard for us because I deal with all the blinding things. I don't like to deal with this kind of patients because to me, it's a bit 无聊 lah. You know what I mean? Yeah, I'm just here to make you look more handsome, more pretty, and you don't have to wear Lao Hua glasses. But when something you're not happy, you want to sue me. It's a bit 无聊. Whereas for me, I'm trying to help people to prevent them from going blind. So to me, I find that more satisfying. The next thing you mentioned is the implantable contact lens. The implantable contact lens is also refractive surgery. It's not my field. But what happens is that they put a contact lens. I'll show you where. They put a very fine contact lens down here behind the iris in front of the lens. It's very fine. Okay. And that kind of lens is being done increasingly. I can easily do it, but I don't because I'm a retinal surgeon. So it's done for people who are short-sighted. Sometimes you can implant for people 800,000, but I try not to do it because implantable contact lenses have a higher chance of complications. Okay, they have a higher chance of infection because it's intraocular. They also have a higher chance of glaucoma, uveitis, iritis, glaucoma, which is sometimes hard to treat, early onset cataract. So these are all the complications associated with implanting the contact lens. So if you want to do it, I mean, sure, you tell the patient, make sure they understand that. And if the patient still thinks, okay, I'll do it, then I mean, it's informed consent. So it's not my field, but I don't do it because I'm a retinal surgeon. But my colleagues who are refractive surgeons, they do it. Yeah. It's quite popular, you're right. It's quite popular. But it will cause problems later for us. Next time when they get cataract, I hope I retired by then. So, because you actually have to remove the implantable contact lens before you start the surgery. You actually have to put the forceps in and pull the bloody thing out. Not easy, let you know, not easy.
Okay, one last question.
Oh, all right. Okay, good evening, Dr.
Yeah, hi.
Now I have a few questions to ask.
Okay.
But no, it's very urgent, I think.
Oh, no, okay. Just run it by me,
Okay, I saw one of your slides that says that when you do cataract, it's more to
rectify the long distance. That means the short-sightedness, is it?
Okay.
I saw
It's
one
not,
person-
it's not short-sightedness. You see, what maybe you didn't understand is that there are, in terms of refractive errors for humans, there are two groups of people. I'm not talking about a perfect sight, I'm talking about there are short-sightedness, which we write as minus. Then there's another group of people that are called far-sighted or long-sighted, which we write as a plus. And both of these groups of people get cataracts. Okay, it's not just short-sighted people. The plus also, they also get cataracts. And why are they plus or minus? It's the physics thing lah. So it's based on the definition. When light enters your eye, the cornea, the lens will refract the light to come to a focus on the retina lah. If you are short-sighted, your eyeball is long. So the focus will fall in front. If you are plus or long-sighted, your eyeball is short. The focus will fall behind. Okay, that's just the definition. But both groups get cataract. Yeah.
Okay. If supposing this is real, it's real happening to me. Okay. If my short-sighted, the is say 200 degrees, all right, and my reading, the long-sighted reading is about 400 degrees.
Okay.
So when I do my mono lens, which one should I correct?
Okay, it's up to you. You tell us what you want. So if you think that for your lifestyle, for your work, if you are mostly doing distance, like for example, who are the people who need vision for distance? Usually bus driver, usually these are people who are like, for example, pilots, architects. But there are a group of people who really just do near work. Okay, these are computer programmers, and some people like to watch Netflix and always on. Yeah, so you tell us what you want. We can adjust the power for you. That means that if you tell me you want to see around this distance, I will ensure that the lens I put in your eye is about 150 degrees minus, so that you can see at this distance. So you tell me what you want. We can adjust. Yeah.
So it doesn't mean that whether the other lens is stronger.
No, it's not.
right?
You just tell us what you prefer. We have our way of adjusting. Yeah.
Okay. So what about, is it okay? Supposing I said, okay, for my this eye, I'd like to correct my reading, my reading sight.
Yes.
And then for the other eye, I want to correct
For distance.
the distance.
Yes, that's fine.
Is it okay?
Yes,
I mean,
that's called monovision.
yeah,
Okay,
mono,
that means that one eye for far, one eye for near.
Yes.
But the question we'll always ask you is, have you done it before? That means that before, when you were younger, in your 40s, when the optician made the glasses for you, did he do monovision for you? That means one eye for far, one eye for near. That means you're used to it. The problem is that when we do for you during surgery, we put the lens is for life. Okay, that means that once we decide this eye for far, this eye for near, we try not to change it, because when we change it, it's an operation. We need to take out the old lens and put in another lens. It's an operation. So we got to be very sure you can adjust. Some people are okay, they can adjust. That means that one eye far, one eye near, they're actually all right. But some people, right, if they've never done it before, they will see the floor like a bit floating. They get a bit disorientated. So we will check with you if you have done it before. If you have done it before, much better. That means we just follow what was done before.
Using its progressive lenses.
Okay, progressive is a separate thing. But when we put mono for you, that means one eye far, one eye near, we will check and see if you can get used to it. Some people cannot be used to it. So if you have never done it before, then we will tell you maybe not such a good idea. Maybe just do both about 100 degrees short-sighted, so you get quite okay vision for far and vision for near, okay, not great, but not too bad. So 100 degrees both sides is the best compromise. Short-sighted, yeah.
Oh, okay.
The long side, just wear reading glasses if you want to see smaller things. 100 degrees short-sighted is not bad. That means that you can see the big, relatively big newspaper headings and all that.
because I was thinking that, after a while, I don't need to do a lot of near reading work. I mean, I'm a teacher, so I need to mark a lot. But soon, okay, bye reading, no need. But but then my friends are telling, but you still need to read your iPhone. So are you going to without specs? Then after that, when you want to read the phone, okay, take out your reading glass.
It's up to you. Like I said, everyone is different.
But it's cartoon or not? If you correct one here, one there.
No, that's what I say. If you're not used to it, it may be disorientating. But it's best that you get this discussed with your eye surgeon. Okay, because it's a very individual thing, very individual. Some people can, some people get adjusted, but some may find it a bit uncomfortable, no? Not everybody's happy with monovision, not everyone, but it's a very good compromise.
Okay, thank you, Dr. Gerard Chua. Thank you so much. Let's give him a big round of applause. And this is a special gift from Avita, Miss Lee. Okay, it's a 4-month supply of Salogen. Okay, yeah, because he needs to take care of himself, okay, to operate until 80 years old, to handle all the younger generation. Okay, thank you, Dr. Thank you. Okay, I mean, I really appreciate, because he really, in Chinese, we say 深入浅出, all the very complicated medical, but even a layman like me can understand. So I think really a big round of applause for Dr. Gerard. Thank you so much. Thank you. And so what do you all learn? For me, my biggest takeaway is don't rub my eyes. Yeah, really, if you have more questions, you really can consult Dr. Gerard at his clinic. Okay, today he's really generous. If you talk to him, he also need to charge one. Okay, so today everybody is so lucky. So remember to bring your Salogen there. Miss Lee already asked for discount, special discount. Thank you, doctor. You can take a seat. Okay. I mean, other than don't rub my eye, another thing that I take away is prevention is better than cure. Right? Really, because there's so many complications. There's a lot of things, especially for the eyes. There are so many things that is very high risk. It's very difficult to cure. So why wait until then, right? So prevention is better than cure. So how do we prevent? Take Salogen, okay? So before we end the session, we would like to invite everybody, okay, to our 16th anniversary. It's on the 18th of August at Marina Bay Sands. Dr. Gerard is joining us as well, right? Yeah! Please do not bombard him with a question. It's not a Q&A session, okay? So who is not coming? Oh, I see somebody almost raised their hands. Okay, so everybody is coming. We took photo already. So if you don't come, we'll charge to your eye point. Okay, okay, but it's really a wonderful evening, and really even on Zoom. Okay, our Zoom friends. Okay, our Philippine partners, our Hong Kong. Yeah, yes, Betsy is coming. Okay. So the night is still young. If you want to know about prevention, how Salogen can help you to prevent, including your diabetes, your eye problem, you can chat with the friends who brought you here. Okay, so that's the end of tonight. Let's give Dr. Gerard another round of applause. Okay, and thank you, Avita, for organizing the industry expert seminar. And remember to come here physically because you got a all right. Thank you, Dr. Gerard. Thank you. Thank you. Thank you, everybody. See you on 18th of August. Bye-bye.